Uh, Good morning. Can you all hear me?
Yes, sir.
Yes, sir.
Yeah. So roughly how many are getting? You don't have idea, no? Usually. There's a small issue concerning me. Like I have been called for a meeting with the minister at 8:30. So if uh, then I'm planning to finish whatever the part of the lecture by 8 o'clock. And is there any other convenient time for you all to have the next part of the lecture? Can you all hear me? Hello? Can you all hear me?
Sir, we can, sir.
Yeah. Then I have an issue that I have to go for a meeting with the minister by 8:30. So I'll be finishing whatever the part I could by 8 o'clock. And I want to have another sessions at a time convenient for you later. Is it a morning or evening that would be better?
Morning will be better, sir.
It's morning better, sir.
Morning better. So what about tomorrow? This time, is it okay?
Okay, sir.
Okay, sir.
Right. So I'll get Udeshika to send the link back to you again, right? So I'll finish whatever I can do by 8 o'clock, and depending on what is left, I will schedule the meeting for tomorrow 7 o'clock. If there's any problem, you let me know. I can even switch to a morning later in the week. Right, tomorrow would be easy for me as well. But anyway, I'll ask Udeshika to get in contact with you and finalize it. So for the moment, I'll fix the second part of the lecture for tomorrow. Okay. Right. So let me start the lecture. I hope all of you have got the lecture note and the PowerPoint presentation. Did you get it?
Yes, sir.
All right. Okay. So let me share the now. Right. What is the view you are getting? Can you see the full slide or two slides?
Two slides.
Sorry? You are seeing the full slide, no?
We can see the full side, sir.
All right. So that's
Full
okay.
side.
Because I am using two screens. That's right. Right. Today I will talk about the injury pattern in road traffic accident. That is medical legally very important because we get a lot of patients, clinical cases following road traffic accidents, and also autopsy cases. Now, if there's any problem between the lecture about the presentation or whatever, just someone speak out and let me know. Sometimes because might get stuck and slide might not move. So therefore, it's very, very important medical legally to be aware about the different types of accidents, different injury patterns, and also to differentiate uh, the types of people who get involved with road traffic accidents. Now, right. So why are we so concerned about RTAs? It's because all modes of transports, including air travel, railway track, all involve some kind of this serious and fatal injury accidents, right? But now, according to statistics, flying is the least. The mode of transport with the least percentage of accidents, right? And also, are following a road traffic accident, there are death and disability of different degrees that could happen to a person. And also, involves a lot of legal issues and commonly encountered type of accident, either in the clinical setup as a patient or the pathological setup as a body sent for autopsy. Now, the first ever motor vehicle accident, which is on record, right, has occurred in 1896 in England. In a woman called Bridget Driscoll, a pedestrian, was hit by one of the three cars giving a demonstration at Crystal Palace, London. So that is the first ever road accident and road fatality recorded. And then these cars were said to be zigzagging at high speeds, being over 4 miles per hour, right? So back in 1896, 4 miles per hour was considered as a fast moving car, right? So you know that in relation to the speed considered as fast in 1896, right? Today we have a lot of vehicles, large number of vehicles moving at much higher speeds than 4 miles per hour, right? And so she has fallen down and died rapidly from head injuries received due to the accident. Hit and fallen and struck the head and died rapidly. So it may be, even the medical management, the efficiency of the medical management available at that time would have also contributed. But whatever, it was considered a rapid death. And now, the number of motor vehicles since then have increased, and speed they achieve is much more than 4 miles per hour. So therefore, that you can imagine how many cases will sustain injuries following road traffic accidents, and how many will have serious injuries, plus how many accidents that would end up fatally, right? So in our setup, it's far more dangerous because there are high speed vehicles capable of zigzagging at very high speed, like even three-wheelers and five-wheel buses. So to complicate the matters, there are dangerous places like pedestrian crossing as well. Why I call it a pedestrian crossing is a dangerous place. That the reason is the fault lies with all the pedestrian and also the vehicle drivers, right? So sometimes the pedestrian consider that at a pedestrian crossing they can cross the road at any time they wish, and sometimes the drivers thinks that before a man crosses the pedestrian crossing, that they can move on before he or she crosses, right? So this leads to fatal accidents, and this is the diagrammatic representative of accident happened about few years back at the Hivala, right? I think, as I remember, all 3 children mentioned at the middle died, right? So it was said to be the fault of the driver anyway. So this could happen very, just a second, right? Now, causes for motor vehicle accidents, one is the human factors, impairment of the driver, affected with alcohol, drugs, etc. Then other human factors like speeding, recklessness, falling asleep on the wheel can commonly contribute to a series of fatal accidents in our country. And then comes the environmental hazards like wet and slippery roads and bad roads. You know the condition of roads in Sri Lanka and most places, right? So drivers also involuntarily trying to avoid certain things in session, and sometimes most of the time meeting with accidents. Then the natural disease like heart attacks, myocardial infarctions, fits, and hypoglycemic or low blood sugar conditions, which impairs the person either permanently or temporarily for a moment, might result in a motor traffic accident, right? So this is a very natural disease is a very important thing that you have to consider in road traffic accident, because it may be the contributory factor, or it may be even the cause of death in certain apparent road traffic accidents. Now, the types of accidents. Now, accidents might involve one or more motor vehicles, or accidents involving pedestrians, and accidents involving motorcyclists and pedal cyclists. So these are the 4 categories of people that we are concerned now when you are talking about road traffic accident. The one or more accidents involving one or more motor vehicles. So that is a one type, right? So one, maybe the motor vehicle goes off the road and hit a stationary object, or 2 motor vehicles collide, or accident involving pedestrian, a motor vehicle and a pedestrian was walking or crossing the road. Then the accidents involving motorcycles and pedal cycles. Now, considering the motor vehicle accidents, right? So now what we are going to concentrate about the occupant of a motor vehicle, and for the general purpose, and as it is easy to analyze, we'll just consider this to be a normal passenger car, which have 2 front seats, driver and front seat passenger, and the rear seat. So you can get different types of occupants in the same vehicle: driver, front seat passenger, and rear seat passengers, right? Now, types of motor vehicle accident may be a frontal collision, where the front of the vehicle collide with a stationary object or another vehicle. Or it could be a side collision, where another vehicle coming from a side road hitting on the side, right? So remember that when it involves 2 vehicles, right? The frontal, now say for example, a vehicle goes hits another vehicle from behind, right? So it will be a frontal impact for one vehicle, rear impact for the other. So likewise, if a vehicle is hit from side, it is side collision for one, frontal collision for the other. So when you are dealing with such instances, you have to consider these facts when we are analyzing the injuries or thinking about possible injuries. So can have the rear impact. Now, those are the 3 common. And apart from that, you can have rollover accidents, where either following one of the top 3 types, and commonly with side collision, that the vehicle could roll over and have additional damage to the vehicle, and also causes more injuries to the vehicle occupants as well. Now, coming to frontal collision, this is the commonest type of all four, and nearly 80% of motor vehicle accidents comprise of frontal collision, and two vehicles colliding with each other. Yeah. Or it may be a vehicle going off the road and colliding with a stationary object like a lamp post or a tree, right? So what happens is when the vehicle is speeding or traveling at a particular speed, and when it has a frontal collision, the vehicle suddenly comes to a stop, right? But now you know that when a vehicle moves, the occupants within the vehicle also move at the same speed of the vehicle. So according to physics, that is what happened, right? So when the problem lies when the vehicle hit the object or another vehicle and come to a sudden stop, momentarily, vehicle stops, but the occupants within the vehicle continue to move forward, right? So the vehicle stops, but within the cabin, occupants move. So they are usually thrown forward, right? It may be complicated depending on the exact mechanism of the accident, but commonly they are thrown forward. So if they are unrestrained, particularly they are not wearing seat belts, they are likely to hit whatever the structures in front of them within the cabin of the vehicle, right? So therefore, if you visualize that thing, it is easy for you to work out what are the structures that they likely to hit and what are the injuries they will receive as a result of hitting these objects. So therefore, we are thrown forward and hit various parts inside the vehicle. And now, then comes that now we have to consider a situation where you have a driver, front seat passenger, and two rear seat passengers. There may be instances that you are required as doing medical legal work, most that to differentiate the four, either in the clinical setup or the autopsy setup, right? So if you considering that, say, for example, there are two people traveling, father and son who is underage, who doesn't have driving license, was driving the car, right? So they meet with an accident, right? And then when the police inquires, they switch the bases. Father claims that he is to be the driver because he knows that if his son gets caught, there'll be more issues, right? So, but now there may be a situation, police has a doubt about what really happened, right? So sometimes you can examine the two patients, their injury pattern, and tell the police, no, this is the driver and this is the front seat passenger, so that we will facilitate or help the police to investigate it properly and take necessary action there. Right? So therefore, it is important to know how you could differentiate the driver from the front seat passengers, or the passengers in the front compartment from rear seat compartment occupants. Now, but then what I'm going to discuss is take different anatomical part of the driver and tell you these are the things, the injuries that he likely to receive, and this is the pattern. Then compare with the injury pattern with the front seat passenger. So when you are considering injuries to the driver and the head, so I told you that move forward. Now just imagine a situation that the driver is not wearing the seat belt. So he can move forward and likely to hit the windscreen, the rear view mirror, right? Because when from the seated position, right, and he's keeping his foot on the pedals, the accelerator and brake, and most likely at a frontal collision at the moment of accident, he will be braking very hard and pushing the brake pedal to the floor, right, to stop the car. So the lower part of the body usually doesn't move forward much, but the upper part, the trunk and the head move forward. So it's like a rotatory movement, and usually head moves forward first. So it's like a rotatory movement. So the head is like to be thrown forward and hit the structures like windscreen and also the rear view mirror, which is at the center. So depending on whether the glass or the windscreen shatters, can sustain cuts or abrasion to the forehead, nose, chin, or even the other part of the face. Now you see that rear view mirror is usually at the, the middle, and it's like a rectangular space, right? So it's likely to driver is likely to hit his left side of the face on the right side of the rear view mirror. So sometimes hitting it will cause a inverted C-shaped abrasions or cut on towards the left side of the face, so usually the forehead, right? So the rear view mirror might cause distinctly recognizable cuts, and that you will be able to say that this is caused by the rear view mirror. It is on the left side of the face, so therefore this person is likely to be the driver, front seat passenger. Then you get the hyperflexion and hyperextension injuries to the neck, right? So relatively head is free to move on the trunk, right? So what happens is depending on the side of the impact, uh, the head is either thrown forward or flex, bend forward and momentarily, and the next time it got extended in the different, the opposite direction, right? So it's like a whipping, it's like a big flash, right? Momently it moves forward, the next moment it goes the other way, which cause high extension flexion movement to the vertebral column, and also sometimes involve the spinal cord within the vertebral column, so that even without much external injuries, the occupant might sustain neurological damage or spinal cord damage or injuries, which may seriously or even sometimes fatal. Then due to this sudden movement, the skull, the atlanto-occipital joint is where the vertebral column joins to the base of the skull, right? So this sudden movement can dislocate that joint as well. And also we can have this basilar skull fracture, or the base of the skull getting fractured, and also sometimes, not very commonly, called diffuse axonal injury, where you get in different areas of the brain, right? So these are few injuries that driver will receive to the head and face. Next come the chest, right? Now it's the part below, right? So now particularly in front of the chest, the injury is resulting mainly by hitting the steering wheel in the case of a driver, right? Because the steering wheel is in line or directly in front at that level, right? So when the body is thrown forward, it's likely to hit the steering wheel. Now, remember that steering wheel is usually at an angle, oblique angle. The lower part of the steering wheel is towards the driver, and the upper part is slightly away, right? And certain vehicles you can have even tilt and adjust. So it depends on the exact position or disposition of the steering wheel, but usually when the body is thrown forward, it hits only mainly hit the lower part of the steering wheel, right? Then So this is reduced by the seat belt and also due to the collapsible steering column, right? So the driver is wearing the seat belt, the forward movement is reduced. So therefore, this hitting the steering wheel may be prevented in some cases, or it they only slightly strike the steering wheel, or in certain vehicles as a safety mechanism, you got the thing called collapsible steering column. So with the impact, frontal impact, or at the moment the body hits, contact with the steering wheel, it collapses, reducing the possibility of injuries due to the steering wheel. However, that in most cases, the driver can sustain injuries due to the steering wheel, and one of the important injuries are the pattern abrasions and contusions. When the lower part or the full circle of the steering wheel hits on the chest, it leaves a abrasion, pattern abrasion or contusion, which resembles either the full or the half or part of the circle of the steering wheel. So when you see it, you know that this is the steering wheel that has caused this injury, and it helps you to identify the driver. Next, forceful hitting on the chest with the steering wheel could cause a transverse fracture of the sternum or the breastbone. So it can put fracture, and also remember that depending on the force, the broken ends could be pushed in, and fortunately or unfortunately, heart lies just below the sternum or the breastbone. In serious accidents, the broken ends could move forward inwards and cause injuries to the heart as well, which might be proven even to be fatal. The next, you can have bilateral rib fractures. The sides of the steering wheel hitting on the sides of the chest can have bilateral rib fractures, which might give rise to even a serious conditions called flail chest, which I will tell you. I think I have told you the injuries, right? Either the same rib breaking at 2 points or having bilateral fractures involving same ribs. And then the broken ends of the breastbone or the broken ribs could be pushed in and cause puncture injuries to the lungs as well, resulting in hemorrhage, filling the chest cavity with blood, or filling the chest cavity with air, whatever it is, causing a problem to the respiration, and it might even proven to be fatal. Then, as I told you earlier, the cardiac or heart injuries, contusions, laceration, and even total rupture of the heart could occur with this following steering wheel impact in high force, high speed accidents. And the aortic transection, now from the major artery rising from the heart is the aorta, which has several parts. The beginning of the aorta is supposed to be free to move. The ascending, the part moving up, then the arch, and the descending part. So that part is considered to be relatively free to move. But when it comes to the thoracic aorta, or the aorta which runs to the chest cavity, it is fixed to the vertebral column behind. So there's a upper part is free to move, the lower part is fixed. So therefore, in impact, you might have a relative movement between the free and fixed part, and sometimes this force is enough to tear it at the junction, the free part and the fixed part. So if that happens, there'll be some leakage of blood, which might even result in almost instantaneous or immediate death. Because if the aorta is completely teared, whole blood will just gush out within few seconds or minutes, and patient will die. And you might not even have time to take him to a hospital for treatment. Then can have injuries to liver and spleen, particularly the lower part of the steering wheel hitting, and depending on the height of the driver, like if it's a tall person, the steering wheel hit lower down the chest, and the liver and spleen is usually partly covered by the lower end, the lower part of the rib cage. So any injuries or the blows impact they are lower down to the layer chest could result in liver and spleen injuries, right? So therefore, some of these injuries could be used to differentiate the driver, especially the pattern abrasion and contusion. Okay. Next slide. Then comes the upper limbs, right? Now, probably you will also realize that when a driver, when a car is, like they say, impending accident, and the driver realize that he is going to meet with an accident, what usually he does is to grip the steering wheel hard with both hands, try to maneuver the vehicle away from the vehicle coming towards you or the stationary objects. They have to try to move away from the impending impact. Right? So therefore, he's involuntarily, suddenly, the moment the steering wheel very hard, and then try to maneuver the vehicle sideways. Right? So usually, at this moment, usually what happens is elbows, both arms. At the elbow, it is extended or straightened, right? But the wrist, the part of the palm, the hand, and the forearm, the joint is slightly bent or right angles, right? So most of the cases, they meet with an accident or the impact happens at this position. They are gripping the steering wheel very tightly with the wrist extended or bent, elbow straightened, right? So in that position, when the impact happens, then the force is transmitted from the front of the body of the vehicle to the steering wheel, from the steering wheel to the hand and upper limb, right? So sometimes this grip and the force transmitted is more than enough to cause abrasion contusions of the palms and also breaking the bones of the hand. And when transmitted force is travels through the wrist joint, which is bent, it can cause wrist fractures or dislocation to the wrist, right? So therefore, one of the injuries that you might see is the metacarpal fractures. Metacarpal bones are the bones of the palm due to tight gripping and transmission of force through it. Then secondly, you can have wrist fractures or wrist dislocation because the joint is extended or bent there. So when the force is transmitted to a bent joint, it is likely to fracture it or dislocate it. Then usually nothing happens to the elbow because it is straightened. So the force just transmits through the elbow, but in certain instances, if it is found to be slightly flexed or bent, you might see elbow injuries or fracture or dislocation as well, but it is much rare than the other injuries. And shoulder, anyway, whatever you do, there's the limb fixed at an angle, right? So it's force transmitted through a joint which acts, which is positioned right angle, which could cause again fracture or dislocation. So commonly it is a posterior dislocation that the dislocated part moves backward because the force is directed from front to back. So these are the injuries that will be present in the driver in the upper limb. right? So all these now, if you compare to the front seat passenger, he doesn't have a steering wheel in front, right? He's not driving, right? So all these actions are done by the driver. So therefore, all these injuries would help you to identify or differentiate the driver from the front seat passenger. Right. Then comes the lower limb. So as the driver tries to maneuver the vehicle away from the impending impact by hitting the side steering wheel and turning the vehicle, at the same time he will involuntarily brake hard on the brake pedal, and so we will push it or pedal it to the maximum, right? So what happened is, again, we have decided, now you can imagine that usually the heel is kept on the floorboard, and the movement from the ankle joint is the movement that you use to press on the brake pedal or even the accelerator, right? So the foot and the lower part of the leg at the ankle, it is bent, and especially if he is not wearing any footwear, right? It is very common, or depending on the force, is likely to have sustain injuries to the sole of the foot, especially contusions. Not much of abrasions, but it can leave a pattern abrasion of the brake pedal on the sole of the foot in the driver. So usually it's the right foot which you use to brake, and you can see that this contusion or the imprint abrasion the right foot due to force to braking. So if you see it, it has to be the driver, not anyone else. The next one is, as for the hand, the transmitted force might break or cause fractures to metatarsal bones or the bones of the foot, right? So it is similar to what happened in the upper limbs. Then can get ankle fractures or dislocation due to braking, because again, similar to the upper limb, it's kept at a right angle. When you keep the rest of heel on the floorboard and move the sole or the foot to brake, the lower part of the leg or at the ankle, it is usually kept at an oblique or right angle, which transmitted force might cause ankle fractures or dislocations. Then patella and femur fractures due to the impact on the dashboard, right? So at the knee, it's slightly, either it's bent usually. So whatever the forward movements could cause the patella or the knee hitting on the dashboard and receiving fractures to the kneecap or the knee joint, or sometimes even the thigh bone. And also, as it is the bend at the knee joint, even without impacting or hitting the dashboard, the transmission of force might result in even knee dislocation. And when it comes to the hip, now the driver is seated, so therefore the upper part of the body and the thighs at usually at right angles, right? So the usually at the hip joint, the force is transmitted directly backwards, causing posterior dislocation of the hip on the right side, because the most of the force is transmitted due to hard braking, transmitted from sole of the right foot to the right hip, right? So therefore you will see in the lower limbs, right-sided injuries commonly in the driver, and the front seat passenger is absent. So all these injuries, the upper limbs, and also the right lower limb, the presence of these injuries will help you to decide who this is, whether it is the driver or the front seat passenger. So when you see these injuries, may not be all, but even few, that indicates that the person to be the driver. So the transmission of force does not stop there. Even after dislocating the hip, it usually travels through the body, right? And then from the hip or the pelvic area to the transmit the force vertebral column. So again, they are likely to receive injuries. Sorry. Right. Right side. Then force applied on braking is transmitted from sole across ankle, knee, hip. Then the sacroiliac joint, where the pelvis and the vertebral column is joined. Then again the vertebral column up to the base of the skull, right? Which result in the injuries like sacroiliac joint at the pelvis and the vertebral column junction or joint can have vertebral dislocation and even fracture atlanto-occipital joint, where the vertebral column fixed to the joints, the base of the skull. And if the force is enough, sometimes the vertebral column may be driven into the skull cavity, causing serious head injuries and even instantaneous death. So that depends on the force of the impact. Then something about the front seat passenger. So most of these injuries I have described up to now is seen in the driver. So the presence of these injuries or combination of these injuries would help you to identify the driver from the rest of the vehicle occupant. Then come the front seat passenger, right? So in the front seat passenger, the injuries tend to be the same as those for driver, but there's no steering wheel, no brake pedal, right? So whatever the force transmitted due to tight steering maneuvering and tight braking will be absent on the front seat passenger. So you will be able for you to identify what the injuries that could result from gripping the steering wheel tightly and braking hard, so that you can move it to the driver. Then think about the common, right? So if you see a patient or a autopsy where there are these so-called injuries, common injuries in driver are absent, then you can come to a conclusion that this person not to be the driver of the vehicle, right? So next, so therefore the injuries due to forceful braking and striking steering wheel are absent, right? So it will help you to identify the front seat passenger from the driver, and they are more likely to hit the dashboard, right? Because nothing coming in between the passenger and the dashboard, and also they are moved forward, thrown forward and hit on the dashboard, windscreen, and sometimes the left side of the rear view mirror, right? So that if that happens, the injury on the face or the forehead will be on the right side of the face, right? In contrast to the driver, which is on left side, and it will be like a inverted C. Again, the rectangular shape of the left corner of the rear view mirror. And ejection possibility. Ejection is throwing the body out of the vehicle is more in comparison to driver, because in the driver, the steering wheel and everything, that he's keeping his leg tightly on the brake pedals or accelerator, those facts will prevent the body being ejected. But in the case of front seat passenger, since those things are not there, they are more likely to thrown out the vehicle through the broken windshield. Then hyperflexion, hyperextension injuries of the neck and head is as same for the driver, because there's no difference. So therefore, that injury you cannot use to differentiate the driver and the front seat passenger. Head injuries, as I told, is also same. Only thing is the injury due to the rear view mirror is on right side in case of front seat passenger. In the driver, it will be on the left side of the seat. And there's something about rear seat passengers. Now they don't have the dashboard in front of them, no steering wheels, no brake or accelerator pedals, front seat in front of them. So therefore, the number of injuries and the severity of injuries is less than the injuries suffered or sustained to the front compartment occupants, right? But they are thrown forward and likely to hit the front seat. But in serious, forceful accident, they might even be thrown onto the front compartment or even could hit the windshield and even could be ejected. Though the likelihood of ejection and hitting the dashboard is less than for the front compartment occupant, can happen, right? The preventing factor is the two seats in front of them. So usually the severity of the injuries and the number of injuries are usually less, and they are somewhat protected from the injuries sustaining serious or fatal injuries in case of especially frontal collision, right? Remember that side collision or rear collision, they might sustain more serious injuries depending on the particular circumstances. So, but any type of injury could occur, but it is less frequent. Then I'm going to talk about the miscellaneous injuries that could cause to both all vehicle occupants, which might in some instances help to identify the driver and the front seat passenger, or just to say whether they are seated on the right side or the left side of the vehicle. One important thing or characteristic is what called dicing injuries. Now, the glasses on the vehicle, usually the side glasses, the door glasses, the glasses, is called, if you happen to look at your vehicle, it says tempered glass, right? So it's same as the tempered glass you fix to the screen of your mobile, right? Which to protect, and why it is called tempered glass. On impact, it breaks into small tubes. So therefore, it won't cause serious injuries. That you know that like a broken bottle or a broken glass pane can cause serious cut injuries and even stab injuries or penetrating injuries. But because at the impact, these are broken into small tubes, it will cause only superficial injuries. And usually the rear windshield and the side windows are made of tempered glass, right? And usually the front windshield is also tempered, but it is usually the glass is between two cellulose layers. So even on braking, it will not. The glass cubes or the particles will not fall, right? So it's doesn't cause much injuries, right? So on impact, this tempered glass usually shattered into small tubes and cause small cuts like bird foot knife, right? Very L-shaped cut or like it appears like a bird foot. I'll show you a photograph of a dicing injury or injury resulting from this short fire. So these are called, these small tubes are called dicers, right? Like a dice where you use in certain games, right? So it's a cube and a dice. So injuries caused by these dicers are called dicing injuries. And driver, it's commonly seen on the right side of the body because the right door and the glass pane is closer to that. That doesn't mean that he cannot have left-sided injuries, but in the case of front seat passenger is more common to should be on the left side, right? So these presence of these injuries also could be used to differentiate the driver and the front seat passenger. For example, now if the window of the right front door is broken, dices will be thrown from right to left, causing injuries to right side of the body of the driver and the front seat passenger. But it is the number of injury or the severity is more in the driver than the front seat passenger, because front seat passenger is covered by the driver, right? So therefore, occurrence of dicing injuries either on the right side or the left side will help you to get some idea about the possibility of whether this person being a front seat passenger or the driver, which could, in combination with other findings, will help you to decide who the driver, who the front passenger front seat passenger is. So front seat passenger is usually on the more on the left side. Now these are the thing called dicing injuries, right? You can see that these L-shaped cuts or bird foot-like cuts, right? So these are called by the edges of the small glass tubes. So that finishes the main injuries sustained by vehicle occupants. I'll just try to go through a few more slides, which is the next one is the function of the seat belt and the injuries. Now, there are vehicles have certain safety mechanism. Commonest is the seat belt, the headrest, and then the airbags. In addition to that, the modern vehicle have so many other safety mechanisms, like the front crumple zone, right? The front of the vehicle easily crumbles on accident, absorbing most of the force, so that the force transmitted to the victim or the occupant is reduced. Then these have this, as I told you earlier, collapsible steering column. And also now the headrest, right? Even if it's a fixed one, it prevents injuries, that reduce the injuries due to the whiplash movement, because it cannot be moved backward because it's the headrest is there. But in the more modern vehicle, they have a thing called active headrest. Like now, if it is fixed, the head can momentarily thrown forward and move backward. So the whiplash injury is not excluded or prevented, totally prevented. But in the most modern one, they have the thing called active headrest, which on impact, when the head start moving, headrest also start moving. So it's only the limited flexion movement and prevent any movement backwards. So if they are about more than nearly 100% prevention of whiplash injury, right? But you cannot manually do it and see whether it is working. It happens on an accident, right? So there are various safety mechanisms, but the two common ones are the seat belts and the airbags. But fortunately or unfortunately, seat belts and airbags can cause serious injuries or even fatal injuries occasionally. But that does not warrant you to wear the seat belts, because consider the probability of injuries caused by seat belt and versus injuries sustained to a person who's not wearing the seat belts is very disproportionate. I mean, injuries caused by seat belt is very much less. So therefore, I'll just go through about the seat belt injuries a while. Now seat belt, you can have front and the rear. Now if you consider the right, the driver in Sri Lanka setup, the seat belt extend from right upper corner to the left lower down, right? So it usually runs from right shoulder to left flank. And on the case of front seat passenger, it's the other way, from left shoulder to the right flank, right? So therefore, that position is also important in deciding who the driver is, right? So it reduces injuries by preventing the occupants being thrown forward, but at the same time, it also causes some injuries, sometimes even fatal injuries. Right? So abrasion and contusion, which angling down from right shoulder towards the left lower region of the chest and abdomen in the case of driver, right? And then as you know that this seat belt has two parts, the diagonal part which come across from the shoulder to the flank, and a lower down, the part of the belt going across lower down, which is called the lap strap, right? Because it goes across the hip, right? So a lap strap will cause horizontally lying injuries. So in a case of driver, it is from right shoulder to the left, and in the case of front seat passenger, it's from the left shoulder to the right lower region. But the lap strap causing horizontally lying injuries is given for both. Then can have sphenic injury, which is common in driver. So because when the strap goes from right to left, angling down, it usually goes to the over the upper left part of the abdomen where the spleen lies. And so if the force is enough, it can compress on the spleen and cause sphenic injuries. And liver injury is common in front seat passenger because the diagonal part of the seat will go on the opposite direction and goes over the right upper part. This direction of the oblique or diagonal part of the seat belt and also the occurrence of sphenic or liver injuries would help you to identify the driver in certain instances. And in rear seat passenger, it depends on the side the occupant is seated. And I will show you some photographs of seat belt injuries. Here, of course, this is the impinged abrasion caused by the seat belt and in case of a driver. Right? Going from the right shoulder to left flank, and here there may be even some associated contusion as well. And this again, contusion left due to the seat belt. And this is an injury which is caused by the lap strap. So depending on the height of the patient, it may be right even somewhere here, or even lower down. So it depends on the position, particularly if it goes across the lower abdomen and the bladder is full, the bowels are full, or even in the case of a woman, is pregnant or not, then depending on the cavity is filled, the cavity is filled, they are more likely to sustain injuries than when it is empty. So they can have bladder injuries, bowel injury, and even injury to the uterus, which might, if the woman is pregnant, might even end up in abortion. Now, this is injuries, and this is what the seat belt has caused. This is due to the erect position. This case of a woman, breast hanging down and coming in contact with the edge of the seat belt. Right. Now, this is where the seat belt injury going from left to right in a case of a front seat passenger, and it can even cause bladder and bowel injuries. And I have told you earlier, and it should show you that with no seat belt, you are more likely to being being thrown forward and sustain injuries and even including injection from the something about the airbags. Asphyxia when the occupant falls face down to the inflated airbags and becomes unconscious. So they are the nose and mouth are covered and they will asphyxiate due to that. Common in front compartment occupants because the airbags are usually in the front, and common in children because the height and usually the face lies in line with the airbags. Something about the neck injuries, as I told you earlier, sometimes they say the seat belt increase the hyperflexion and extension injuries because the body is fit and the head is moving over. Right, so this is the whiplash injury which causes sometimes cause severe head injuries. Neck, cervical column, vertebral column injuries, and spinal cord injuries. So this is what happened. Right, either way, it is thrown backwards and forwards in almost instantly. Right, I think I shall stop the lecture for today. And so, is it okay? I fix the lecture for tomorrow
Okay, sir.
morning. Is it okay tomorrow morning, 7 o'clock?
Okay, sir.
Right.
Yes, sir.
I will get Udeshika to send you the link. Right. So see you tomorrow at 7 o'clock. Right. Okay. Thank you. Then I will end the session for tomorrow. Okay.
Thank you, sir.
Okay. Right. Someone asked for the recorded version. I am not sure whether it is possible. It is on record, right? So I will get it. I will ask them to send you the full lecture, right? Maybe in 2 parts, today's one and tomorrow's one, right? So I will get the link for tomorrow's part of the lecture within today, right? Okay. Right. Okay. See you then.